Come and meet the rest of the team down in the dorm room.
This is our home care department, where the managers in here, they actually support the healthcare assistants in the different areas. And unlike some companies, you know, we're a pretty good company where we actually work with the carers to make them great. Okay, so if you see accidents actually happening here, our carers are just the same. Okay, come on in.
We've got an open door policy whereby the carers just walk in, maybe have a coffee, a cuppa, or have their break. We monitor the carers actually logging in and out through an ECN system. So this is the team of care managers and care coordinators. Tim is our care coordinator, who works very closely with brokerage.
Yeah, so I started out working in Lanark Court, which is a mental and psychiatric hospital. Then I found a job here with Spectrum. Darren and Jill took me on. Progression through the years, I now manage all the contracts and deal with brokerage for all the services for Spectrum.
This is Shalina, who manages our satellite office.
Hello, I'm Shalina. I've got a background in care home working, but I now care manage the area of Estrigan Lice.
This is Susie, another one of our care managers. She's got a background in domiciliary care, joined the company in 2016, just before myself, and again manages domiciliary throughout Powys and Torvine. At the moment, she's got the great pleasure of offering one of our employees a promotion within her role.
This is Lucy, and she's recently been promoted to team leader, and I'm just going through individual bits of paperwork that are essential that they need to have in the files in the community. Lucy, tell us a bit about you.
I've been with the company coming up to 2 years now, and I currently work in Torvine. Before this, I used to work in a completely different job, and it was just in the local Domino's doing deliveries, and so now it's been a complete change for me. And it's been, I couldn't imagine doing anything else now.
Do you enjoy your job?
I love it. Yes, I do. Yes.
Back to Darren, who will discuss and explain to you how we're developing the service and developing under the new risk regulations our nursing and domiciliary.
Yeah, brilliant. Thank you, Jill. So, so our domiciliary is completely developing all the time. You know, we've got a new satellite office opening in the city of Newport, and that office is going to serve discharges from the Royal Gwent Hospital and any people who basically need our care in that area. We're also developing new satellite offices in Powys, in Bracken areas, where Susie Harris will be managing with Shalina Phillips. And so we're very, very busy, you know, thinking of our service users, addressing their needs as soon as possible, you know, and always there for them. We also do a 24-hour on-call system where any of our service users or patients need us. We're always there at the end of the phone for them, and we've got on-call staff as well who attend to any emergency situation, whatever there may be. You know, if it's in the locality of our head office, you know, and there was a crisis situation with maybe one of our service users with mental health issues or learning disabilities, our train managers here and myself, we all attend to everybody and any crisis situation which comes about. Come on, you're fine. Okay, in 2018 we re-registered the company with Care Inspectorate Wales under the Regulation of Inspection of Social Care Wales Act 2016. And when we registered our company as a new domiciliary care company, we combined a clinical team of clinical staff, so registered nurses, and psychiatric nurses, so we could deliver nursing care into the community, whereas we can actually help somebody who doesn't want to necessarily move into a nursing home. They can stay in the comfort of their own home and receive nursing care at home. It's a fantastic model, you know, and we were so grateful to Care Inspectorate Wales for processing our application. And since we've been re-registered, the clinical team which we've added to our company is actually exceeded, and people are so happy now that they've got this opportunity to stay in their own homes. It's just fantastic. This is Deb Snedden, our clinical care manager. Deb, if you want to give us some background.
I've moved down from Birmingham, where I was a healthcare assistant for a company there for 6 years. I started on the domiciliary in 2017 and progressed onto the agency, where I became senior care manager and became care coordinator and care manager at the end of 2018. We've been working towards getting packages assisting people with disabilities that are end of life, and
Lovely. So you're currently doing a lot with learning disabilities as well at the moment, aren't you?
Yeah,
So tell us a bit about
do
that.
day centres. We assist them and escort them to day centres and into respite.
Brilliant.
And we're within the home and care home setting.
Right, brilliant, great. Lovely. So another part of our company here at Spectrum Healthcare, we actually supply staff to nursing homes and hospitals, majority of private hospitals, and we do a lot with CHC, which is continuing healthcare, which is actually filling gaps of sickness for nursing homes. If nursing homes are in problems, if they can't recruit staff, you know, we're always here to help and assist any nursing home which is in problem or crisis even. You know, recently we won the partnership in crisis awards from an Iron Bevan Health Board, which was to do with a nursing home where the owner went AWOL, and basically there was nobody to pay the staff in this particular nursing home. So Spectrum Healthcare actually stepped in, took over the nursing home, worked as a complete partnership with Continuing Healthcare, Care Inspectorate Wales and ourselves to safeguard the service users in their home and keep the nursing home running until it then passed hands into other ownership. So this department here, our agency staffing, we supply homes in Wales. Most of the nursing homes in Wales use Spectrum Healthcare as their first core agency supplier, and also we supply healthcare assistants and nurses to homes in the southwest of England as well. So Bristol areas, Bath areas, Devon and Cornwall. So this team in this room here, this is Penny Powell, and Penny is our care coordinator for the agency. Penny, if you can tell our viewers a bit about yourself.
Hello, I'm Penny Powell. I've been here for nearly a year now. I got put into the office by our kind Darren. I am the agency admin and care coordinator, so as Darren previously said, I put people on shift, make sure everyone's allocated their right job role.
Okay, and what's your dedication, Penny, in regards, say a nursing home rings you and they're really struggling for staff, say, I don't know, they've got 5 staff off sick, what are you going to do about that situation?
Get staff in. How many staff they need, we get them.
Okay, so on some occasions we've actually, particularly when nursing homes are closing down,
Like phone calls in the morning.
when nursing homes are actually closing down, we actually then are asked sometimes to staff the whole nursing home. So one in particular I know about in the last 3 years, we supplied up to maybe 30 staff just to run this particular care home. You know, and then when the Care Inspectorate Wales were closing the home, you know, our staff came in, helped with the closure, so we weren't involved in the complaint side of it, but our staff provided excellent care for the service users in that home so it can remain open until such time the home changed hands, basically. So yeah, so Penny, in your background before you came to Spectrum?
Oh, I used to work in a low secure psychiatric hospital for teenagers, which was obviously mind-opening, whereas we work with dementia patients, which is a completely different aspect of mental health, really.
Yeah, very good. Lovely. Brilliant. Nice to meet you, Penny.
Nice to meet you.
Hey!
Brilliant.
Darren's giving us all a £5 an hour increase.
Yay!